Cast is now starting. All attendees are in listen-only mode.
We'll give it about 1 minute for any final logins to occur. Sometimes I know there are technical difficulties. All right, I have 1 minute past the hour. Well, good afternoon. Welcome, everyone, and thank you for joining us. Today's panel and our registration list includes an impressive array of individuals from the European Commission and European Parliament to state and national and even regional authorities, environmental and healthcare advocates, and health systems, among others. We've even piqued interest across the globe, from India to Canada and the United States. So for everyone joining us here today, I greatly appreciate you making time to join us in this program. My name is Dan Vukolich, and for the past 20 years, I've had the privilege of serving as the president and CEO of the Association of Medical Device Reprocessors, which represents medical device companies engaged in the business of reprocessing and remanufacturing medical devices. Among other priorities, our mission includes creating educational forums and opportunities for healthcare savings and sustainability initiatives, promoting a globally harmonized regulatory framework, and bringing together stakeholders. And so I appreciate you joining me here today. If you'll allow me just a few sentences to give background on my association, in 2019, AMDR member companies reprocessed and remanufactured for over 7,000 hospitals and surgical centers globally, helping them to participate in a global economy or a circular economy for medical devices. By remanufacturing devices that hospitals already own, they're able to not only build resiliency into their supply chain, but reduce waste and reduce their global environmental impact. In fact, in 2019, AMDR's members helped their healthcare partners eliminate nearly 7 million kilos of medical waste from going into landfills or into incinerators. This environmental contribution also comes at no additional cost. In that same time period, medical device remanufacturing helped health institutions reduce their cost by nearly €500 million in 2019. Unfortunately, medical device remanufacturing is not yet allowed in most EU member states. I think today's panel is particularly timely as we're looking at the implementation of the EU medical device regulation by this May. Eric Hansen of the European Commission will talk about what the requirements are on member states in order to allow reprocessed or remanufactured medical devices within their border. It is AMDR's view that the medical device regulations, reprocessing, and remanufacturing provisions present the greatest opportunity for hospitals to reduce waste, reduce cost, and reduce their greenhouse gas emissions. As to today's panel, the European Parliament and European Commission's main strategic policy initiative post-COVID-19 is the implementation of a Green Deal and Circular Economy Action Plan. This will lay the foundation for a more sustainable European future. Today's webinar will address how these programs relate to the healthcare sector. Sadly, until recently, the tremendous toll that the healthcare supply chain takes on environment and human health has often been overlooked. In fact, Healthcare Without Harm, from which we have Dorota Napierska today on the call, has done research concluding that if the global healthcare economy itself were a country, it would be the 5th biggest contributor to global greenhouse gas emissions on Earth. At 4.4% of global pollutant emissions, the healthcare sector contributes more to climate change than the entire global aviation industry. In a field where we take the pledge to do no harm, this is unacceptable. In our quest to deliver life-saving technologies to patients, we have come to accept a consumable, disposable, take, make, waste culture that has created a massive medical waste problem. It frustrates national budgets, and unfortunately, the incineration of this waste makes people sicker. It is therefore AMDR's hope that as the EU moves forward with its Circular Economy Action Plan, that will include the healthcare sector. In December, the respected journal Health Affairs found that of these emissions stemming from hospitals, 70% come from their supply chain, which includes medical devices, many of which are labeled for single use, which prompted the study authors to call for the medical device and supply industry to move to more sustainable and circular product offerings. So as to our panel here today, in addition to Healthcare Without Harm, we will hear from representatives of the European Commission and the European Parliament on the new Circular Economy Plan, the Medical Device Regulation, and the Sustainable Products Initiative. We'll hear from the European Committee of Regions on efforts to make a cleaner and more competitive Europe, and we'll have later on a representative from NHS who will report on their Net Carbon Zero initiative. Today's keynote speaker is Anna Schulte from the Fraunhofer Institute for Environmental Safety and Energy Technology Umsicht. Anna will present the results of her recent research published, a life cycle assessment of remanufactured devices compared to virgin medical devices. This study, as she will explain, quantifies the environmental benefits of expanding the circular economy to the healthcare sector. I'm very proud of the panel that we've assembled here today, and I hope by the end of our session, each of you will be as convinced as I am that the time has come to bring the healthcare sector fully into the circular economy. For our registrants today, just as a note of housekeeping, there will be a Q&A at the end of the session today. There's a chat function on the right hand of your screen. We have a team that will review and vet each of those questions and then prepare me to put them to panelists at the end of the program. The one exception will be for Anna Schulte on her life cycle assessment, where we will also do a Q&A immediately following her segment in the agenda. All right, our first speaker and my friend, Dorota Napierska, represents Healthcare Without Harm, one of the world's leading advocates for a more sustainable and less environmentally harmful healthcare system. Dorota, may I turn it over to you?
Thank you, Dan. Good afternoon, everyone. I'm really grateful for an opportunity to speak at this important and I think very timely event. I will speak on behalf of Healthcare Without Harm Europe, a non-profit membership organization of European hospitals and healthcare systems. Next slide, please. Sorry, I will just sometimes have to say this. So we are a non-profit membership organization of European hospitals, healthcare systems, healthcare professionals, research, environmental and health organizations. And our members' work is dedicated to reduce the environmental footprint of healthcare. Next slide, please. In Europe, we currently count 154 members in 30 European countries from WHO Europe region. It is worth to mention that Healthcare Without Harm is a global movement with 3 regional offices, one in Europe, one in US and one in Southeast Asia, as well as virtual team in Latin America and many partners around the world. The European members belong also to the global Green and Healthy Hospitals Network. And GGHH is a project of Healthcare Without Harm launched in 2011, which has grown to a community of over 1,450 members in 72 countries. So representing the interest of more than 43,000 hospitals and healthcare centers. As actually Dan already mentioned a couple of numbers from this slide, but I just wanted to say that while the main mission of the sector is delivery of the patient-centered care, a connection between this mission and sustainability unfortunately occurs still quite rarely. And the picture of environmental footprint of healthcare is indeed unfortunately very worrying. Not to repeat, but important indeed that if the healthcare sector were a country, it would be the 5th largest emitter of the global emissions on the planet. And actually, healthcare sector within the European Union is one of the highest polluting healthcare sectors after the US and China. And evidence shows that more than 70% of emissions are actually driven by the supply chain. And it's not really such a surprise if we realize how healthcare sector is currently dependable on the use of disposables, and how actually healthcare sector is using, producing, using, and disposing the products, is really emblematic of the linear economy. And it seems kind of logical also to think that alternative to counteract those unsustainable practices would be shifting more to circular healthcare economy model built on principles of resource conservation. And to support our members in making this shift, we published last year a guide that provides step-by-step guidance, tools, and resources for healthcare organizations to develop a sustainable purchasing strategy. All this is supported by strong evidence built on experience and case studies provided by our network. And as you can see, for example, on the right side of the screen, importantly, a change to more sustainable and very often reusable products and services brings not only environmental but also significant financial benefits for hospitals. And medical devices reprocessing has proven to play an important role here as well. Next slide, please. Practice Green Health, which is the US membership affiliate of Healthcare Without Harm, offers excellent resources on medical device reprocessing, which is recognized as one of environmentally responsible practices. They also measure the success of those initiatives that are translated into very impressive saving. You see the numbers also on the screen. And it is worth to emphasize also that the real success and scaling up of reprocessing in the US started with a strong regulation and strict guidelines. So saying that, we must actually be very pleased with the medical devices regulation and common specifications that are already in place. Next slide, please. Last year, Healthcare Without Harm in Europe fused two existing programs, Safer Chemicals and Sustainable Procurement, into one new circular healthcare program. So basically, you want to stimulate European healthcare systems to improve their consumption patterns and to drive markets towards toxic-free products that conserve resources, minimize waste, and contribute to an ethical supply chain and circular economy. And in line with our global strategy, we consider that reprocessing of medical devices can support hospitals on their way to maximize this reuse, minimize waste, and as already said a couple of times at the end, also save money. Well, but this obviously needs some support from national authorities who have to make this reprocessing first legal and possible. So with this reflection, thank you very much for your attention, and I'm looking forward to the next presentations and fruitful discussion today. Thank you.
Thank you so much, Dorota. And I did not mean to steal your thunder by restating the research findings that your organization has put forward. I do think it's worth repeating. I think a lot of people are surprised at the enormous environmental toll healthcare takes on the environment. So we're appreciative of the work that you and Healthcare Without Harm are doing to bring attention and solutions. So thank you. Our next speaker is Paula Migliorini, and she is Deputy Head of Unit Sustainable Products, Consumption and Production for the European Commission. Ms. Migliorini will give an overview of the EU Circular Economy Action Plan, and hopefully will speak to the Sustainable Products Initiative. So I'll turn it over to you. Thank you.
Thank you, Dan, and thank you precisely for putting up the presentation. So if you allow me first to thanks for this opportunity to speak about the Circular Economy Action Plan and the Product Policy Initiative, precisely because we know that there is a lot of attentions and a lot of expectations from the many stakeholders. We've been talking about it for several, I would say several years now, because if you, those who have followed circular economy already under the first action plan, 2015, knows exactly that we needed and we wanted to act upon design to start this transition to circular economy. Now with the second action plan, so if we can move to the next slide, I put here what I call it a contextual slide. So circular economy is one of the priority of the European Green Deal. As you know, for those of you who follows the European affairs, knows that in December of 2019, we have adopted this growth strategy for greater sustainability for Europe, so the European Green Deal. You have learned also by now that the COVID pandemic didn't change our plans, so to say. So we are firmly continuing on the policy for sustainable growth. Simply we have added, and not simply, it's a big euphemism, because of course, as you can imagine, it's very complex. We have added a layer of recovery and resilience with the plans and the funds, precisely to ensure that all the stakeholders, being in the public sector or the private sectors, are capable to overcome the obstacles brought by the pandemic, and at the same time take these opportunities that were there already before for greater circularity, so greater sustainability overall. So this just to confirm the line of principles that were set in the European Green Deal. Concerning circular economy, of course, the main aim is to mobilize industry for bringing the activity of the industry towards cleaner and more circular economy. In the next slide, you know by now what we have adopted, and in fact, I see now it's the 11th of March, so it's exactly 1 year that we have adopted the Circular Economy Action Plan. So there wasn't the usual share of information that we could have had with conferences in presence, but I think this past year we really were able to reach out to an enormous amount of stakeholders, presenting the action plan and the 35 actions that are included in it. Allow me to just go very quickly onto an overview of the action plan, and then we focus on the most important, the ones that are in red there. So we want to make with the action plan that will cover the next four years, more or less, so this commission, to ensure that all products that will be placed on the EU market are sustainable by design, so that sustainability becomes the norms. We need to empower consumers to also to do that, and then we need, in the context of this product framework, product policy framework, to address the false green claims that are made and that there are out there, in order to ensure that there is no confusion. There's a clear line for producers and then a clear line of information for consumers as well. The action plans also foresees a series of actions for 7 key product value chains. They are listed there. Some of you are of direct interest for you. But others, I think, have shown and that this is the reason why we selected them, an enormous untapped potential. I'm thinking about the packaging or textiles, food, and then other areas that really, if the sector would move towards greater circularity, that would ensure important cost savings, benefits for the economy, and also in reductions of emissions and the fight against the climate change. Among the actions, we of course also included some legislative measures for waste. The big difference with the previous action plan, I think there's a focus on waste prevention rather than just waste management this time. So I think this is really a measure of the success or the consequences of the activity under the first action plan. Several reviews of legislations that were already foreseen there. What we also want to do, and then I think that the following speakers, or a couple of speakers after me, will really focus, is the colleague from the Committee of the Region will also stress how it is important to involve people, regions and cities in this transition. So try to mobilize the public sector as much as possible, and I'm very happy to hear when Dorota was introducing the guide for procurement in the healthcare. I think this is exactly one very good way to go forward. So I will be happy also to give as much visibility as possible to this initiative with, for example, the Circular Economy Stakeholder Platform. But this can come after in the feedback and then the follow-up to this intervention. And then the last point of the action plan is that we want to lead on global efforts. In fact, just last 22nd of February, I think we announced we launched the Global Alliance on Circular Economy and Resource Efficiency. So try to mobilize, just as today examples, all sorts of partners across the globe onto this plan for circular economy. So this is in a nutshell the action plan. If we go to the next slide, I can focus more then on the initiative that is of your interest. So first, allow me to clarify the terminology. You must have heard about a framework for sustainable product policy or sustainable product policy framework. This is the overall name that we give to at least 3 main initiatives. So the initiatives on sustainable products policy, that I'll give you more details in a second. The one on empowering consumers. So for those of you who follows very closely the activity in Brussels, the initiatives that will be tabled by DG Just. Dealing with consumer law. And then the third initiative is the one on green claims, so using PEF to substantiate any green claims. So this is an initiative that is coming up also from our services in DG Environment. So this is the product policy framework. Now I'll be focusing on the Sustainable Products Initiative, which is an initiative that we thought was necessary because mainly we see, and you are the first to see this, many products break down too quickly or cannot be easily reused or repaired, recycled, remanufactured, refurbished, I should say, in your case as well. And many are made for single use only. Yeah? In the healthcare, I don't have to tell you that. So you also know that at least 80% of the product's environmental impacts are determined at the design phase. So how important it is to really ensure that the design is the appropriate and the best, and then that allows for refurbishment and remanufacturing at the end as a first choice. Huh? So for the moment, there is no comprehensive set of requirements that ensures this sustainability and the circularity for products, and then we needed to clearly act on that. And at the same time, it has been seen that there are no sufficient incentives for the manufacturers to internalize the costs that are linked to the impacts of a product. Huh? So all across and all along the value chain. So we needed to address these 2 points. With the next slide, you see what are then the objectives of the Sustainable Products Initiatives. So we will widen the scope of the Eco-Design Directive to the broadest possible range of products. We say always all the products, but clearly you need to be rational in time on the products that are going to be addressed. We're going to establish some sustainability principles, some overarching principles, and setting some product-specific requirements. So just for those of you who follows and knows how the Eco-Design Directive works with work programs, we're going very likely to function in the same way. So establishing sets of products for which we will develop more specific product requirements. But overall, we will try to have principles that will apply to all products concerning, for example, durability, reusability, upgradability, reparability. So the discussion that you might have heard about the right to repair, some of that will come through the Sustainable Products Initiatives and some through the Empowering Consumers Initiatives. We will increase, wherever possible, product specifically or overarching, the need for including recycled content and measures to facilitate remanufacturing, being measures on the production processes or on supports to adapt infrastructure. We will look to restrict further single use. You know that we have the directive on single-use plastics, but we'll look to expand or to address at least the single use, also in line with the safety requirements brought about by the COVID pandemic, but this is something that is going to be developed further. Looking to counter premature obsolescence, and then banning the destruction of unsold durable goods. Business models, I think you owe to give it a specific focus in your own activity, and I know that in your sector you're already doing a lot of that. It's going to be clearly one important element that will make it's a game changer for circularity, and moving from ownership of the products to or moving the ownership from the consumer to the producers, actually, more in that sense, and see how we can include some provisions on the initiative per se, or facilitating this change and this adaptation in SMEs and in larger companies. We also look to, this is a big novelty, I think, of the Sustainable Products Initiatives, finally provide some solutions for a digital product passport, so ensuring traceability of materials and of substances in a product along the value chain. So the technicalities of this digital product passports are not yet set, but we know that many different solutions exist. What is more complicated at this point is to understand which level of information is necessary to which actor in the value chain at which moment. So, you know, trying to have a comprehensive system that targets exactly the right information to the right person. So this is something that is going to be included as well. And then again, addressing minimum requirements for public procurements on products. Still to be seen if we look into it in the Sustainable Products Initiative or in the specific product requirements. This needs to be addressed. And then also we look to include some social aspects through the life cycle of products wherever that is feasible. Now on the timing of this initiative, so then you can contribute and join in the preparation of the initiative. We have had several exchanges in the past with stakeholders. We are launching the open public consultation in a couple of weeks. I would hope that this will happen before Easter for 12 weeks. So we really look forward to receive a lot of comments from all the relevant stakeholders. So then we can improve, and we are working on to the impact assessment. So then that would feed into the impact assessment, and then so then in a way to be able to present the proposal by the end of the year. So this is really a lot of intense work, and occasions like this of today and the follow-up are particularly interesting for us because precisely it allows us to go and talk directly and listen to a specific sector with specific products, because again, you understand the complexity of coming with an initiative that addresses all the products, but then that is efficient enough to address the right product with the right measures. So this is something that it's very complex, as you can imagine. In the next slide, I just wanted to say, and then with this I will conclude, we're not busy only with the Sustainable Product Policy framework, but what can you expect in 2021 as other measures? So from the Circular Economy Action Plan, maybe not all of them are of interest or relevant to you, but just to understand how large we are addressing, we will come with a textile strategy and try to bring more circularity to the sector. An initiative on circular electronics that will target more laptops and tablets and small electric and electronic devices, mainly in a first point to in combination with the digital product passport, as I was saying, but also trying to explore the right to repair elements for these items. We are planning to review also the Packaging and Packaging Waste Directive this year or the next. This is what's going to keep us quite busy. We are revising the rules on waste shipment. And then we are, as I said, active also on international level. Since we have launched the Global Alliance, now we are working towards an international agreement, more specifically for plastics. And with this, I would stop here and then make available for questions. And I just want to recall that I will unfortunately have to leave in shortly 10-15 minutes, but I'll be very happy to provide any bilateral feedback as needed also to continue this conversation with the association.
Well, thank you, Paula. We really appreciate it. And because you do have to go, just to confirm, so based on what you've said here today, and all the work you're doing, for those of us that are in healthcare and interested in having sustainable products within the healthcare market, it sounds like we will have the opportunity to engage with the Commission to encourage inclusion of all of these great initiatives you have going, but for healthcare products.
Yes.
Super.
Absolutely.
Wonderful. Well, thank you. All right,
Thank you.
Thank you very much. In the interest of time, we'll have to keep moving. So thank you very much, Paula. I appreciate it. Our next speaker is Sirpa Pietikäinen, Finnish member of the European Parliament. And Sirpa, forgive me, with a name like Vukalic, you'd think I'm used to having my name butchered, so I apologize if I butchered yours. But representing the European People's Party, she's a member of the Economic and Monetary Affairs and then the ENVI Committee, which is the Environment, Public Health and Food Safety. She served previously as Finland's Minister of the Environment and will discuss the Parliament's report on the Circular Economy Action Plan. I don't see you, but are you here?
I'm here.
Okay.
And thank you. And I do apologize for the quality of the video connection. I didn't know what happened with that, but now you just would need to be in faith and believe I'm not a bot, I'm a human being. Thank you, Dan. You did not butcher my name. It was
Good.
a perfect pronunciation.
Good.
And then actually, I do have only one slide to show to you, and that is the next one. To look this as all in all, because I did assume that the Paula will go through all the details. And my first point is that we would need 4 planets worth resources, at least 3, but probably 4 planets worth resources by 2050, if we do not make a drastic change. And so the first, and that was the most important signal what the parliament came with, is that you need to have the right ambition level. That means that if you do not remember anything else what I have said, please do remember that by 2050, in all sectors, it includes yours as well as in all the variety, you would need to produce the same welfare, the same income or the better for your company, and the same quality or hopefully better for the customers and the patients than today, with 1/10 of the resources. So 1/10 part of the resources, so that we keep on the planetary boundaries that is the absolute and non-negotiable. Well, how to achieve that? First, get the target right, because otherwise we undermine our efforts and we end up using a lot of money and a lot of investment and sort of underperforming if we think that, okay, it's just tweaking the system with 5% or 10% will do the trick. Let's make the masks a 10% lighter, and that'll do it. And this is sort of a paradigm change, and it needs a lot of work between the years. So in our thinking, how to achieve this. To get it right, and this was the second main ambition level from the parliament, is you need science-based targets and indicators. And this is, I know, is in process going on in commission and internationally also. But this is something where I hope that all the industry sectors, yourself, can provide the science-based information and to participate on creating the indicators, and the target is then with 1/10 by 2050, and it would be halving the resource use by 2030. Then when you look at this, you already heard that the biggest part is done the 80%, the famous 80% in the product policy and in the design of the product. But it is also on the design of the processes. And one part is of that, of course, the service economy and that kind of reusable products. And in some parts, let's say in some equipment and facilities, that works, of course, in healthcare and in hospitals. But the big part, as you know, and this is in medical devices also, is disposable. How many times can you say COVID-19 test? Not that many. And then you would need to separate which part is like the CT scans of the head, where you could basically use for eternity the heavy part of the scanning machine, where you have the lens and everything, and change only the digital part, the intellect, to get the better pictures, instead of scrapping the whole half-ton worth materials. So that is one part. And there if you service all the digital fast development, if you service all changeable and sort of a thinking in modular way, that is the easy one. But then the tricky one is that comes, of course, with hygiene and disposable goods, tests, and all the big variety what you are having and we are consuming. And the question is, in which parts, I know it's not very big, but it would make sense to use reusable equipment, because then again, if you go in some of the equipment, there's sort of a transportation, washing, reusing, and repurposing might have a big environmental impact. So one needs to be pretty careful. And in those that you can't do that, the question is, how do I make it non-toxic? So basically, you could compost or you could eat it. And because even though it is incinerated, we know that with cumulative toxicity, we do have an issue. And how could you design together using that kind of materials that would be, when the hygiene allows it, to be repurposed as materials or composted? Composted, of course, and the mask is, I would say, a beautiful example. No one thought or planned it a prior, that actually you should have easily compostable masks, because quite understandably, there's a limit how long you can use it. But then when it comes to hospital equipment, it comes to testing equipment and many of these, can you compost them, or can you use and develop a molecule recycling? And I think that this is one very promising track, molecule recycling facility, to get the plastics and other materials back on closed loops on the economy. So service what you can, tenfold the time consumed per equipment. If that is not possible, then try to create closed loops, closed material loops, either via molecule recycling or then composting materials. And then this is sort of the order of the products. All should be durable, upgradable. This is the digitalizing in huge sense, reusable, repairable, and then recyclable at the highest level, be it the equipment or be it then the material. Then, okay, what this all means? This means, and that was referred already, that we do have the new elements of recovery money to be used in investments, and we have a sustainable finance initiative. That means that the industries are able to get green credits, they products or industries to be labeled green if they are providing higher levels of circular economy in the long run. This will take about 3 years or something, but there's the investor interest also on this side. And then last but not least, because I know that this is only commentary and you would like to have the time for discussion, I would like you to keep me on closed loop with you and with your ideas and developments, because the challenge is great. Medicine, packing, hospital equipment, long-term personal medical devices, and all that. So I'm happy to be included on your thinking and your innovations. And please do remember to to try to get the EU funding for those initiatives as well. Thank you.
Thank you, Sirpa. We really appreciate it. A lot of good questions you've asked here, some of which I know at least Anna will be able to start to answer some. So we're encouraged that we're creating more research in this area. So thank you. Mr. Stelpstra, you're up next. Mr. Stelpstra is a regional minister for the province of Drenthe in the Netherlands and a member of the European Committee of Regions. Minister Stelpstra will present on the role of local and regional authorities in promoting a cleaner and more resilient Europe. You have the floor, sir.
Thank you very much. It's without slides. I told you I'm a politician and I'm just speaking. Very much thank you for being your guest this afternoon. And I'm very pleased to see in how many branches circular economy is a topic. And that's not just without a reason. I will refer later on it. Last year I was a rapporteur and wrote an opinion on the new circular economy action plan for the Committee of the Regions. And this opinion was adopted by the committee in October last year, and I'm very happy to share some points of my opinion with you. But let me start with a general remark on the current context. The COVID crisis is very urgent, and we must act on it without hesitation. And you know, and I think you know maybe better than others, this crisis is about health, it is about life. And let's hope it's a temporary crisis. There's no doubt, even though it's a crisis with great effects on the world economy, and a recovery from this crisis is needed. But there's also another crisis, and that's also about health, and it's also about life, and that's the climate crisis. And where COVID seems an acute illness, the climate crisis is an insidious disease which, on the other hand, just more and more manifests itself as acute. And I make this remark because the COVID crisis has some side effects which can be helpful in the recovery from that other disease. First of all, COVID showed us how dependent we are on resources. Just living as a normal citizen, I saw a shortage on simple products like, in my country, aspirin and mouth masks in the start of COVID. And in the papers I saw there was a shortage on breathing equipment. And in a rich country as my country, the Netherlands, we were dependent on materials from China, from Turkey, from the United States of America. It was because we outsourced the industry or didn't have the resources ourselves. COVID has also shown us how quick a recovery on the environment can be. In a very short time, rivers got clean. Even air pollution, even in China, even in New Delhi, the air pollution decreased. And we have seen also how resilient people are in these times. In no time, a complete shift to working at home, digitalized meeting, without flying all over the world, it was done. And at least it is important to keep these effects in mind, the negative and the positive ones. But I must also be honest, although I'm an optimist, we have a lot of work to do in order to prevent us from reverting to old behavior. Just in general about the question why. Why is it important? Existing linear economies prove to be wasteful and environmentally damaging, as well as dependent on globalized linear supply chains and cheap virgin raw materials. And circular economy is an instrument that can help decouple economic growth from resource use and from environmental impact. Therefore, it can help to shape a pathway towards a more resilient and low-carbon economic recovery. And what should be done? I told you the COVID pandemic had shown us how dependent we are on resources. And therefore, this crisis was seen as a wake-up call in multiple ways. And this means we have to act on different levels. On the European level, which may be in many times the bridge between the global level and the national and regional level. And beside this governmental approach, there is, of course, the other very important level, companies, industries, product makers, and last but not least, product users and consumers. And let me give some remarks on these levels in the short speaking time left. First, on European. I think it's very crucial that the European Commissions and the member states steer the investments from the EU recovery plan in such a way as to guarantee long-term economic, social, and environmental progress. And in order to reduce dependency and strengthen security of supply, the European Commission and the member states should orchestrate resource management, especially scarce and critical ones. The development towards an EU resource policy platform should be explored. I'm happy there is a member of parliament to hear this. To achieve the goals we want, we need targets. It was also said on several subjects. And one overall target should be that we relate circular economy to the reduction of CO2. And linked to target is innovation. Innovation will help us to set standards. And one of my recommendations was that innovation today must be the standard within 5 years. Extended producers' responsibility is a crucial strategy to ensure proper business cases in which producers also look into safe and circular by design consequences. This will also help to prevent waste. And talking about waste, there are many crucial resources labeled waste are available in Europe. But in order to reach a true circular economy, the mind shift needs to switch towards a paradigm. There is no waste. Waste doesn't exist. What we call waste is a collection of resources. And COVID has shown us how dependent we are on these resources. So keep them. Don't waste any waste. On the way to a true circular economy, a shift towards a zero waste mindset is needed. And it is important, an important principle that in the circular economy, all materials will be designed in such a way that they become either nutrients for the biosphere or new materials for the next cycle of use. And it calls to propose a target on absolute waste generation for per capita and for waste prevention targets for business and industry. And to validate the principle there is no waste and prevent the use of virgin resources, an obligation to use recycled materials is essentially. Therefore, the European Commission needs to set criteria whereby a substantial proportion of new products should be made of recycled materials. And LRAs, local and regional governments and authorities have a lot of competences related to resource management and circular economy. There are competences on waste, on water, on spatial planning, on building, and they can all be used on the way to a circular economy. And don't forget our role in stimulating innovation. My own province, we are stimulating, for instance, the making of bioplastics with subsidies, with education, with matchmaking, European programs which help us. But LRAs have also an important role in the transition towards the circular economy. They are more than others close to the citizens, and that's important because these citizens are the consumers. So in education and awareness building, local and regional authorities have an important role. They can help us not to build a circular economy, not to help a circular economy, but more intense, a circular society. I think that's what we need. And there's a lot to do. And it's a reality. There are front runners, there are laggers, and it's a big challenge. But let us use this reality as a great opportunity for cooperation. And there will also be skepticism and ignorance. And that's we all, and especially governments, I think, have a lot of work to do. We must convince our citizens, our companies, our industries, and the clients about the importance of this transition to a circular economy, and show them it is not only making the world better in an environmental way, but it is also the next step to more welfare. So I'm an optimist. I'm hopeful. COVID has shown us that we are resilient. In no time we made a change to a digital economy. So I hope we can make in no time the change to a circular society. Thank you very much.
Thank you, and I hope so too. And I'm thankful for your participation here today. As healthcare is often delivered at the regional or local level, I think you're right. That's sort of the tie that binds. And so I'm appreciative of your participation today. Thank you. Anna, to introduce you, I'm going to ask Dr. Manfred Renner, Division Director for Products at the Fraunhofer Institute for Environmental Safety and Energy Technology, UMSIG, for which he's a recognized, Fraunhofer is a recognized center for excellence for environmental impact assessments. and he will introduce Anna Schulte, our next speaker. Dr. Renner, are you on the line here today? I don't see him.
Okay, can you hear me now? And is the presentation shared?
Let's proceed then. Anna, welcome. Thank you for putting together these slides here today. And then Flores, if you can give control of the deck over to her, we'll begin. Great.
Can you now see my screen?
We can.
Okay, then I switch to hopefully presentation mode. Okay. So my name is Anna Schulte, and today I will answer the question if medical remanufacturing can save. Oh, no, I definitely don't. Sorry.
Hello.
Just need to do this again. So I'm about.
Hey, Sierra, can you put your mic on?
Okay.
Ei kun, sitä pitää katsoa, otetaanko se kansio pois. Katsoa mitä hänelle kuuluu.
Cut the mic on anybody with Anna.
Nyt on jännä.
Still hear some noises. Can I just proceed?
Yeah, please do. And then in the back,
Okay.
of course, we'll see.
Okay. I go ahead. Okay. I want to answer the question if medical remanufacturing can save resources and greenhouse gas emissions and how this contributes to the circular economy. But let's do this step by step, as I'm a scientific. So at first, I will give you a short picture of who I am and what I'm working on. This work is part of the Fraunhofer Cluster of Excellence Circular Plastics Economy, and the cluster has the purpose to bundle competencies of 6 Fraunhofer institutes along the value chain of plastics. And the cluster is subdivided into 6 research departments. So we are developing circular polymers, additives, works on alternative recycling technologies, circular logistics, sustainability topics, as well as care for prototyping and circular business model transformation. And I am a PhD student at Fraunhofer Umsicht, and I'm assessing products in the context of sustainability and circular economy. We prove that medical remanufacturing is a good example for circular value creation, and I would like to tell you why. So we deal with questions such as how to prepare a product for circular economy, how to assess products such as single-use medical devices, and how to gain more transparency and decision support. So looking at the value framework, you can see that from cradle to gate, the pre-use phase, value is edited up to the point where the product is over the counter. And after use, the value is destroyed unless we apply strategies to retain this value. According to the value principle, strategies such as reuse and remanufacturing can perceive more value compared to recycling. And it follows that we should always consider the loops closest to the user at first if possible. And as we did on LCA, and for those who are not familiar with life cycle assessments, I will give you a short introduction. LCA is conducted following a 4-step approach. At first, the goal and scope phase, defining the system boundary and the so-called functional unit, which is a reference unit, and then the inventory data is collected, so the inputs and outputs. It is followed by the impact assessment phase, where different impacts are calculated based on impact assessment methods. We use the so-called environmental footprint method, which is recommended by the Joint Research Center. Then the interpretation is the 4th step, but it is actually relating to the previous steps. So in this case, we did a contribution analysis, a sensitivity analysis, and a circularity assessment. But I will proceed on that later. To classify the novelty and the research gap, medical remanufacturing might be most promising circular economy strategy for single-use medical devices because they cannot be reused directly and can nor be recycled. And we did not find an LCA in the sector of medical remanufacturing so far that's similar. So our task was to investigate whether medical remanufacturing can reduce environmental impacts and contribute to circular economy. We were able to demonstrate this using the example of electrophysiologic catheters in a commissioned case study by the Vanguard AG, and we published this in the Journal of Sustainability. The publication analyzes environmental impacts of remanufacturing catheters compared to virgin production. In the study, we chose two modeling perspectives, a common LCA approach and the combination with circularity indicator, and placed them side by side. The approach with circularity indicator is not intended to replace the common methods, but should complement the depth of interpretation. Both perspectives have the same functional unit, so they're comparable, but they differ in some points. While the common approach provides information on the environmental impacts caused by the use of a product over a single life cycle and a short time horizon, the other approach with circularity provides information about the environmental impacts caused by the establishment of a collection and remanufacturing system. The system is extended and the entire pathway of a product is assessed considering multiple product life cycles on a longer time horizon. Thus, a comparison between a linear and circular production system becomes possible. In order to understand this modeling perspective and the process itself, I will shortly explain the system boundaries and in the common approach before we move to the circular. In virgin production, the catheter is produced from virgin material, then transported to the customer and disposed and treated as waste. Here, we do not give energy credits according to the so-called cutoff approach. For medical remanufacturing, we started with a collection of catheters as burden-free product, which are then transported to the remanufacturing process, consisting of an identification, sterilization, inspection, sterile packaging, and final packaging step, before the product is transported to the customer, and after use, the loop is actually closed, and we place also, according to the approach, a cutoff. So building on this, we then integrated the circular assessment. But why do we need this circular perspective in LCA? Circularity and sustainability are closely linked, but they can also contradict each other. So we want to provide decision support in order to find circular solutions that are most sustainable. We combine established LCA methods with circularity indicators in order to identify circular pathways that have a sustainable benefit. We apply a product or material tracing perspective. A common approach is comparing two different production rules, for example, virgin and remanufactured products. However, on a system perspective, both product systems need to be observed as a pathway, and therefore we need to understand how often a product is passing a specific product cycle. So far, we are not comparing different production routes, we are comparing different systems with circular actions taken into account. For those who always wants to have formulas, I noted down the formula, but for those who cry because of formulas, I will skip it for now. We are measuring impacts from loops along the value chain, and the novelty is that our approach mirrors life cycle thinking and maps multiple product cycles in order to depict the system perspective. So integrating this perspective into the system boundary, this means that we have the linear production where the catheters are produced from virgin material and then disposed, resulting in a circularity of 1, which means that the product is used once, a fully linear system. And in the circular system, catheters are produced from virgin material as well, but then collected for remanufacturing according to the previous mentioned steps, several times until the product is lost. Product losses occur in every loop, e.g. due to failed identification during the remanufacturing, resulting in a circularity of 2.09, which means that the product is used on average 2.0 times in the circular production system. So, and now let's come to the more interesting part, the results. At first, the results of the commonly used LCA approach. We prove environmental benefits in 13 out of 16 impact categories evaluated with more than 20% savings from the medical remanufacturing compared to the virgin production per catheter. Environmental drawbacks were calculated for eutrophication of fresh water, land use, and water scarcity. However, further research is needed here to prove that. The focus is set on the global warming impact, which is represented by the impact category climate change, and the abiotic resource use, represented by the category resource use, minerals and metals, because these are the most discussed in the context. Here, the global warming emissions were cut about half when using a remanufactured catheter compared to virgin. For abiotic resource use, a saving of 28.8% were calculated. To keep it short, here only the results of the global warming impact are shown. The common LCA results can inform an environmental conscious client. So when using a remanufactured catheter, 50.4% savings can be achieved compared to using a virgin catheter. For virgin production, the main contributor are the plastic production and processing, but for medical remanufacturing, the main contributors are the use of electricity and waste treatment. The LCA results with the circularity metric show the environmental impacts of the linear and circular production system. This approach could provide information for policy and other decision makers, as it shows the transformation potential from linear to circular use of catheters applying a remanufacturing system. That means that in a fully circular production system, the carbon footprint could be reduced about 34.5 compared to linear production. The result of 1.14 kilograms CO2 equivalent per catheter is representing the value of the catheter being produced from virgin material, but then remanufactured several times until the product is discarded on average. Assuming that 750,000 electrophysiologic catheters are used in Germany every year, a full collection of catheters for remanufacturing would save about 450 tons of CO2 equivalents per year, in contrast to linear remanufacturing. However, reality is of course between fully linear and fully circular system. Therefore, the collection rate was varied in the figure on the left. The results shows that the savings per catheter are increasing slightly exponentially with increasing collection rate for remanufacturing. For example, if 20% of the catheters are collected, a saving of 5% could be obtained compared to zero collection. Doubling the collection to 20, however, slightly increases the savings to 11%. If a straight line is drawn through the first two reference points, the effect becomes more clearer. The more is collected, the more is saved. Assessment methods, including a circular system perspective, are important when assessing the transformation potential to a circular economy. And now ending with my main take-home messages. Circular value creation. Claims to both environmentally and economically beneficial compared to linear value creation. Medical remanufacturing of single-use medical devices is an excellent example because it has the potential to perceive the product as the highest value, to be circular and reduce environmental impacts compared to virgin production, and reduce environmental impacts on a system perspective. A legal obligation for medical remanufacturing for medical devices with high remanufacturing potential could be a key to circular economy and more sustainability in healthcare system. And then I would like to thank you, and I'm open for very short questions for now. Thank you very much.
Thank you very much.
I hope you could follow me.
Well, I think I followed some of it. If I can, I see there are some questions coming up in the chat function here, but if you'll indulge me, I'm not a scientist. So if I was looking at the various inputs that you were quantifying in this life cycle assessment, an issue came to mind, which is, a lot of people might question the environmental benefits of a product that's remanufactured. It also has to be transported. It also has to be cleaned using water or detergent. It also has to be sterilized. Did I see that perhaps the lower life cycle assessment with a remanufactured product, even though it goes through all of those extra processes, is because it's less resource intensive on extracting materials from the earth? Is that sort of a fair takeaway from your data points?
Yes, because of you avoid the primary extraction of the virgin plastic, and that's actually the main contributor in the virgin production route. And then it is, we just calculated that the use of disinfectants and detergents are less or cause less environmental impacts than the primary extraction of the virgin plastics.
Wow. Okay. Are there any other questions from the panelists with regard to Anna's presentation? Anna, having heard what you've heard today and having actually done research such as this, one panel or one questioner asks, what can be done to bring healthcare more into the EU Circular Economy Action Plan? Unfortunately, we've lost Paula, one of our authors on the action plan, but what would be your comment to that?
Yes, as I'm a sustainability scientist, I can only prove how the different production routes and how the transformation potential is, and just give some advance if that we might need a law or some regulations for that in order to collect these catheters, as I showed that the more you collect, the more you can save. And even then might not be the point of, yeah, you can save it. I think you have to save these resources because you're throwing away a major value, environmentally value, because you have to, I showed you the value hill principle, and you have to go all the way down to save the material, but at least it's just a sterilization step and testing and sterile packaging. So it's so near to be environmentally and economically beneficial. So I don't see any reason why you could not get, or why anyone could not get this point.
And I've got one more question if we have time. Somebody wants to know, and I guess this is a good question since we're not all electrophysiologists. What is an electrophysiology catheter made out of? What's its material composition?
Yeah, it's made mainly out of plastics and very high complex polymers with special medical polymers. And when I get the bill of materials, so the plastics that are in the catheter, and I showed them to my plastic experts, he said, oh, I think most of the normal plastic expert has never seen those plastic or has never been in contact. So they do not play a role in municipal recycling infrastructure. So the main plastic is very complex polymers that are not so easy to get, such as, I don't know if such as PEBAX, which is or PEEK, which is polyethylene eta ketone. So.
And if we wanted to promote circularity at the product design level, would the material composition of these products help at the design set to help set gas emission reduction goals?
What do you mean by the design set?
Yeah, I mean, could we make these things of different materials or make them more durable to get an improved life cycle assessment?
I think I would have to ask our plastics experts because of that, because I think that these products have to fulfill very high product quality and requirements, and the typically or the artificial polymers might not fulfill these requirements, and because they are way cheaper. And I think if that would be the possibility to make them full recyclable, I think someone would have done this.
Okay. And there's also precious metals in the distal tips of these catheters, like gold, platinum, and such, correct?
Yes, that's correct. But on a mass base, this does not take so much into account.
Okay. Well, Anna, I know I'm sure people have many other questions, but we're going to have to move on. Of course, if you don't mind sticking around in case there's time at the end of the program, we can put other questions that come to you then, if that's okay. Wonderful.
Yeah, that's okay. I will be here afterwards.
Thank you, Anna, very much.
Thank you.
Very eye-opening. Thank you. Eric Hansen from the European Commission, you are up next. Eric, you, I believe, are the Deputy Head of Unit for Health Systems, Medical Products and Innovation with DG Sante for the European Commission, which I understand is responsible for implementing all new healthcare legislation. If you'll walk us through what national ministries of health and or hospital supply leadership needs to know to understand the regulatory requirements to allow reprocessed or remanufactured devices on their markets.
Yes, thank you for the introduction, and thank you for the invitation to address this conference. So I'm coming now with the legal part. But I have been given 8 minutes by Dan, so I have put the egg clock here to be sure that I will not exceed this. So I will look into the quite interesting concept of the new medical devices regulations when it comes to the reprocessing of single-use devices. It's interesting because it leaves a lot of options to the member states. It's an example of partial subsidiarity, and also it's a minimum legislation, which means that member states can apply stricter requirements on national level if they so wish. Next slide, please. So if we look into the new MDR regulation that becomes applicable on the 26th of May this year, it states clearly that reprocessing of single-use devices is possible only if permitted by national law. So there we have the first example of subsidiarity. Then there are more options for the member states to decide upon, because
Oh no, are we experiencing a technical glitch here? All right, I think we've lost Eric. Just to confirm, you can hear me, right? This isn't my delay. Okay. All right, well, hopefully Eric will join us back. Oh, there he is, there he is. We lost you there for a moment.
Okay, I'm sorry. So there is also a possibility for member states to decide that they will apply the implementing regulation with common specifications. That also becomes applicable on the 26th of May. So if they decide so in national legislation and the reprocessing is carried out within a health institution, and the safety and performance of the reprocessed device is equivalent to that of the original device, then the member state can decide to apply these common specifications. So for the member states, this means that first they need to decide whether they want to permit reprocessing at all, and if they do so, they need to decide whether they want all the requirements for manufacturers of the legislation to apply, or if they want to instead make use of the common specifications. If they make use of the common specifications, they can also decide whether it should be possible also to subcontract the reprocessing outside the health institution. And they could also, as said, decide whether they want to introduce even stricter conditions or requirements than what we have here if they allow for reprocessing. So a lot of choices to be made by member states, and we know that some member states have already made this choice, whether to go for allowing reprocessing or not. Some are still considering what to do. So next slide, please. So just a few words then on the common specifications for those that will be applicable then in those member states that decide to go for this option. So these common specifications contain requirements on organization and risk management. For instance, then on contracting of external reprocessor when this is allowed, staff, premises and equipment, monitoring of changes made by manufacturers, determination of reprocessing process, technical documentation and so forth. Also procedures and step of the reprocessing cycle, the quality management system, annual audits and reporting of incidents, and also on traceability, for instance, tracking of reprocessing cycles and records. Next slide, please. So, as I said, there are a number of options then for member states to decide what they wish to do with this new legal framework. So the member states have the obligation to notify us whether they will permit reprocessing of single-use devices, and also in which way they want to use this, whether they wish to use the common specifications, and also the outsource of the reprocessing to an external reprocessor. And of course, if they introduce provisions that are stricter than those that are laid down in the MDR, for instance, if they would wish to restrict or prohibit the transfer of single-use devices to another member state or to third countries, or the making available or further use of reprocessed single-use devices within the country, then they also need to inform us about this. So we will come back to the member states in the near futures after the 26th of May to ask them to inform us about these the decisions taken on a national level. But as already mentioned, we know that there are a number of member states that are still discussing what to do in relation to the reprocessing of single-use devices. So by that, I think that even with some margin, I managed to stay within the 8 minutes. So sorry for this rather legal intervention. I hope still it gave some picture about what will be the future requirements in the EU.
Thank you, Eric. And so just to confirm, so by the implementation date, so May 26th of this year, if a member state has not taken action to affirmatively allow common specification reprocessing or allow the sale of remanufactured CE mark devices, reprocessed devices, it's illegal in that market. Is that correct?
That is correct, indeed.
Okay, so it's really incumbent upon the member states to act before that deadline if they want to allow such products.
Well, they can do it also after, if they wish, they can take a decision also after the 26th of May. But if they want it to be applicable already from the 26th of May, obviously they would have to do it before.
Okay. Thank you very much, Eric. Thank you. All right, our final speaker today is Alan Wayne, COO of Supply Chain Coordination at the UK's NHS. Actually, Mr. Wayne's interest and commitment to the reduction in carbon emissions that I think we're here today, as it at his request that the NHS study prompted Anna at Fraunhofer to put together her life cycle assessment. So, Mr. Wayne, I will turn it over to you.
Okay, thanks, Dan. Can you hear me okay? Just give me a thumbs up, because I know my technology failed earlier today on a webinar. And apologies for arriving late into the meeting, but I did just catch the back end of Anna's presentation, so that was good. As you introduced me, COO, Chief Operating Officer for NHS Supply Chain. And just to put it in context, NHS Supply Chain delivers about 60% of what the NHS consumes in medical devices and clinical consumables. So we supply a big part of the NHS in England. If I can go to the first slide, please. So sustainability is high profile now within the NHS. This year in particular, because the UK is going to host the COP26 conference, there'll be extra emphasis put on sustainability in our supply chains. And I think the NHS accounts for about a quarter of the carbon footprint of the whole of the UK. So it's pretty significant contributor to the CO2 emissions footprint. What the NHS has got is a strategy that was developed last year and published in October, called Delivering a Net Zero National Health Service, and you can Google that and pick out the full document, which is 50-odd pages on the strategy. We actually developed a strategy in NHS supply chain slightly earlier than that and based it around 4 pillars of sustainability, of which waste and the circular economy is one of those pillars. We are aligned with the delivering a net zero strategy, and we are a major contributor to that strategy. And as I say, waste and the circular economy will form a big part of our contribution. So if I could move on to the next slide, please. So when we're looking at remanufactured, we look at actually 5 R's in the circular economy altogether. And remanufactured isn't the only one of those sustainability parameters that we're looking at. And it will largely depend on the device itself and on the pathways that the NHS is using as to which of those 5 R's will be applicable. We're looking at all 5 of them, and we're developing strategies along all 5 of them. So changes in pathways, we're encouraging our suppliers to come up with innovations that are more sustainable than the current pathways. That will reduce the amount of usage of the medical devices and therefore reduce the carbon footprint. Sterilization techniques are predominant in the NHS and are becoming more common practice now with the focus on sustainability. And particularly during the COVID crisis, we've been looking at being able to sterilize PPE, for example, and then reuse that PPE. So that's a very current example of looking at sterilization. And then incorporation of recycled product is another area that we're looking at, particularly around plastic products, clinical waste bins, sharps bins. They're plastic products where you can incorporate recycled materials into those. But today we're going to focus on the remanufactured devices and just talk a little bit about those. So if we can move to the next slide, please. And the next slide really is just showing the preferences that we would have. So we'd rather reuse and sterilize than go down a route of remanufacture. But remanufactured is quite sophisticated, as Anna has already demonstrated in her presentation. And so some of these devices, you can't simply just put them through a sterilizer. You've got to take them apart, you've got to reprocess them, put it back together, and make sure it's clinically safe to use again. So that's the remanufactured. The least favorable option for us is when we're disposing of devices or other equipment, is to try and recover the materials in some way. And in fact, this is part of our journey for remanufacture, because within the NHS, these devices, these EP devices, have got platinum tips to them. And the NHS for quite some time have been cutting off the platinum tips and getting the recycled value of the platinum in those. But from a sustainability point of view, that's not a fantastic option, because the rest of the equipment is discarded and incinerated. So that's why I've been working with Vanguard of late to try and introduce the remanufactured device into the NHS and get a much bigger uptake on those devices. So maybe we could move to the next slide, please. And just to put it into context for us where remanufactured sits, if anybody would take up the delivering a net zero strategy document, within that document you'll find this diagram that we're looking at here. And what it shows is the challenge for the NHS as a whole in it needs to take out something like 16.5 million tons of carbon dioxide equivalent per year just from the supply chains that operate into the NHS. So on top of that is reducing its own carbon footprint, but this is the ambition, is to take 16.5 million tonnes. What this diagram does is to break that down into various components where the carbon footprint can be reduced. One of the biggest contributors is actually down our supply chains into the NHS. So the suppliers own carbon footprints, and that would account for about 4.5 million tonnes. But you see towards the left-hand side of the diagram, there's a couple of elements. There's 157,000 tonnes that would come from remanufactured or reprocessed devices, and another 202,000 tonnes from reused and refurbished. So I kind of class remanufactured into those two particular categories. So there's a significant amount of carbon dioxide equivalent that we can reduce, and it will be a contributor to the whole, but you can see that the whole is a big picture here. So remanufactured isn't going to answer the whole of our questions, but it's going to make a major contribution to the reduction in carbon footprint for the NHS. So if we could go to the next slide, please. And this is where really the relationship with Vanguard and the remanufactured devices kicks in. And Anna, you'll be familiar with that diagram, and the rest of the audience will have already seen it. So I'm not going to talk to the diagram other than you can see that it's roughly about 50% of the carbon footprint in a remanufactured device. It's slightly less than that if you look at the LCA, but it's still very significant in the carbon footprint reduction. But importantly for us is that to achieve our objectives for the NHS, we need to be working with our strategic suppliers to get that major seismic shift on the carbon footprint reduction. Vanguard, we've been working with as a strategic supplier. We're doing a lot of engagement around the NHS for uptake of these devices. It actually starts with the collection of the original device, and then that going off to Vanguard's reprocessing, remanufacturing unit to remanufacture them to be able to be used again by the NHS. The next step is to get a bigger uptake of these devices within the NHS. There is at the moment a small amount of uptake, but the ambition is to get to a much larger footprint of 40 to 50% of the devices being used are remanufactured devices. So I think with that, I'll finish off and just say remanufactured is an important part of our strategy. It's not the only part of our strategy, and we are looking to work with our strategic suppliers to drive down the carbon footprint right across the NHS. So thank you for that.
Thank you, Alan, very much. One issue you pointed out that I think Eric may be able to give an answer to is, you know, remanufacturing or reprocessing a device is a lot more complex than throwing it into a sterilizer. And so as to ensuring the safety and efficacy of these products once remanufactured, Eric, they have to meet the same standards as applied to the manufacturer when sold as new, correct?
In principle, yes, yeah.
Okay. And so the
my understanding, Dan, is that they have a separate CE mark. So there are notified bodies that actually certificate these devices and give them a separate CE mark. As you'll know, with EU exit, the UK now is not part of the European Union, but we are still recognizing the CE marks, and there will be other registrations that creep into the UK market through our regulator, which is the MHRA.
Okay, thank you. The one last question I want to address is somebody asked which member states have already been supportive of reprocessing, I think I'll take that one, but AMDR will publish on our website the regulatory status of each member state once adopted. So far, the Netherlands and Belgium have allowed such products and notified the Commission. I expect Germany soon, and I would hope before the May deadline, we're going to have some others that will report favorably towards allowing these products as well. But as discussed here today, the member states have to act. Well, I cannot thank this panel enough. I hear tremendous support from the varying viewpoints brought here today for inclusion in healthcare and efforts to make European efforts more sustainable and circular in our thinking. And so I'm thrilled to hear that, and I hope each of us from our individual standpoints will encourage the Commission and the Parliament to continue down that path. As we've talked about from Anna's research and from the example that Alan and others have brought up, reprocessed and remanufactured medical devices, however, are an immediate solution. Of course, member states have to act. Mr. Stelpstra had pointed out the long way we have to go, and like him, I'm an optimist, but at least with regard to medical devices, we have immediately available reprocessed and remanufactured devices should the states allow them. So I think that's all fantastic news in the right direction. And so I thank you all, and hopefully one day soon when we can travel again, I can thank you personally. I want to thank everybody that's attended here today. The strong participation, I think, is a testament towards the interest in creating a more sustainable healthcare system, so thank you. Up on the screen is my contact information. If any of you have questions or are looking for more information, then that's available here today. Please don't hesitate to reach out to me directly. As I said, I'll also be updating the AMDR website. And lastly, I'd like to thank my team, our partners at ADS Insight, for their creation of this panel, and my team, David, Allison, Paul, and everybody back in Washington. Thank you. Thank you, everyone, and enjoy the rest of your evening. Good night.
Cheers.
Thank you. Bye-bye.
Thank you, Eric. Thank you, Alan. Thank you, Anna. Thank you, Dorota. Thank you, Scott. You've all great. Thank you. I'll call you later to touch base, but you got the rest of the night off, so I'll talk to you maybe tomorrow.
Okay, bye-bye.
Thank you so much. Bye-bye. Michaela, may I send you a Teams invite so we can hang up here and maybe we can speak briefly via that function?
Sure.